Every single day in clinic, I see a baby that looks like this, and the parents still have a lot of questions even today about what exactly is newborn jaundice, what causes it, what can we do about it, and what are things we need to look for. So hi, I'm Dr. Tracy Tyson. I'm a board-certified general pediatrician. I've been doing this for over 20 years. Let's talk about newborn jaundice. This is something that I think we in medicine forget, how much the general population doesn't truly understand about this. So I wanted to make sure you understand where it comes from and all the things to have to do with it. So first of all, newborns are born with a little bit more red blood cells than they actually need, and they're immature and they break open pretty easily. So in that first 48 to 72 hours of life, they're breaking open their red blood cells much quicker than an adult does. When you break open your red blood cells, which happens all the time, it has a byproduct of it called bilirubin. And bilirubin is something that if you are an older person who has a healthy liver, you get rid of through your liver in most cases, and it's usually not a problem. However, in newborn babies, they don't have that ability very easily yet. They need to get rid of it through their skin, through their pee and poop. And so they have a harder time with that in the first few days of life. The reason this is a problem is because bilirubin as a byproduct, when it's floating around the bloodstream, can pass into the brain and cause CAT scans that look like this. Those deposits in the brain cause something called kernicterus, and kernicterus caused seizures, brain damage, developmental delay, and in really rare cases, death. Prior to us screening for bilirubin, this was not an uncommon problem in the United States, and the only thing we could really do was some indirect sunlight and just feed your baby like crazy. So we started monitoring bilirubin levels in the 1970s consistently, and there are graphs that we follow, such as this one, where we monitor that level going up over the first few days of life to see which baby is more at risk for higher bilirubin. And here's what we find. Babies who have some birth trauma because they have extra damage to their red blood cells, that little bit of bleeding has to be broken down. That can lead to increased jaundice. Babies who are breastfed have a little bit more dehydration and concentration of their blood, which causes those levels of bilirubin to be higher. There are some rare genetic disorders, but in general, this is mostly a physiologic or typical process that happens. The other thing is if the mom's blood type is different than the baby's in a specific way, it causes those antibodies from mom to attack baby's red blood cells. They turn over too fast. So those are some common risk factors. What we are looking for is that yellow color in babies starts around the eyes, the face, and as it extends down the body, in general, that means the level is going high. So when we are just assessing your baby or looking, we are looking for how far down the body does the jaundice go. The farther down the body it goes, the higher risk that number is at the fear of 20, which is the number that pediatricians and family prac docs fear everywhere, and NICU doctors as well. We're trying to prevent that level from getting to 20 for any prolonged amount of time so we can prevent kernicterus. So what do? We check frequently and we talk to you about your baby's hydration status. The more hydrated they are, the lower that bilirubin level is, the more that they pee and poop and getting indirect sunlight. If we're doing all those things and it's still rising, we might do something called a Billy blanket or phototherapy. This can be done at home in some cases and in the hospital in other cases, depending on where you live, access, and the level of jaundice. That is a UV lamp or blanket that helps pull more bilirubin out of the skin. We might also offer supplementation, so talk to us about that if you'd prefer donor milk and or formula, or just more express breast milk if baby's tired. Rare cases, we would do IV fluids, and in really rare cases, we would do something called exchange transfusion, where we pull the blood off, put more saline in to get that level down extremely quickly. This is rare, thank goodness. We don't have to do it very often, but that's why we do screenings, is to prevent us ever from having to do the treatments in most cases. So this is what your doctor is looking for after your baby's born. This is one of the reasons why those first few visits are so important, because we want to make sure no baby gets kernicterus, which is completely preventable. If you have any questions, let me know.